Let me tell you about major changes that came into effect in the provinces of New Brunswick and Alberta and how it impacts you as an international educated nurse. So today, February 2nd, 2026, the province of New Brunswick now has a new name for their Nurses Association. They used to be called the Nurses Association of New Brunswick, NAMB, but effective today, they are now called College of Nursing New Brunswick, CNNB. So if you have been visiting that portal and you have been meeting a different page, the red and white and all of that, that has all changed. You're now going to have a different landing page. So if you do go back, do not worry about it. You're still on the same portal. They just have a new name and a new look, but the mandate is still the same. Now let's go all the way to Alberta. In the province of Alberta, effective February 2nd, 2026, which is today, HCAs, which is healthcare aides, are now a regulated profession. What does that mean? That means that going forward, for you to work as a HCA in the province of Alberta, you must now be registered with the regulated college. You must now meet standardized training and competency requirements, and you must now have a valid practice permit. Now, before now, this used to be a largely unregulated profession, and that made it easy for international educated nurses to work in this support role while they await licensure for their RN or their LPN. Now, that pathway has changed. Okay, what does that mean for you, and why is the province doing that? Well, let's talk about why the province is doing that. First of all, I think, or from the top of my head, I'd like to say for patient safety and quality control, for standardized training and accountability, and obviously for better maybe work planning and professional recognition, I'd like to say, which is not a bad thing if you ask me. But how does that impact you as an international educated nurse? That is what the crux of this conversation is. So going forward, obviously now you have to realize that the HCA position or the HCA role is no longer an easy entry point for you as it used to be as an international educated nurse. Okay, the other thing is you now have to re-strategize. That's the long and short of the entire thing that we're saying. You have to re-strategize your entry point into the health system if you still want to be in the health system while you're waiting for licensure and credentialing for an RN or an LPN position. And then you need to start thinking non-clinical positions, because this position, the HCA position, is obviously going to be a competitive one, because employers would only want to onboard HCAs that are now regulated and now have a valid practice permit. Okay, now what are some of the non-clinical roles that you can be thinking about? Maybe you can think about working as a medical assistant. Maybe you can think about working as a porter. I know these are not the things that we want to do, but you need to do some things to get by, and you've got bills to pay anyway. You can also work as a DSW. I know that's a role in the province of Ontario, but I don't know if it is in the province of Alberta. You can also start thinking working like a ward aide or something, if I haven't mentioned that. Those are some of the non-clinical things that you can do. I'm sure there are more. I probably have to look them up and share them again with you, but these are the things you need to keep at the back of your mind. Now, does it mean that HCAs are now replacing nursing since HCAs are now regulated? No, that's not the meaning. It just simply means that the province has decided to move forward in terms of professional recognition for HCAs. And I said already that it's not a bad thing. It doesn't mean that the scopes have changed. The LPNs will still have their scopes, RN will still have their scopes, and obviously the HCAs will still have their scope. But this is how the province has decided to move forward with this whole arrangement. Okay, now I know that some people will say or would wonder, can I still work as a HCA even though I'm an IEN? Well, that's a yes, but you have to take that yes with some caution. What do I mean? I simply mean that going forward, if you still want to work in the health system and still be a HCA, you now have to be assessed and you now have to have a practice permit, which I know would obviously impact your finances in terms of your planning, because everybody's working with finances and, trying to strategize and all of that. So if you must, then this is what you then need to do. So you have that at the back of your mind. I hope that this has helped one or two people today. If you did find this helpful, please like, share, and follow me for more tips, because I will continue to share with you so you can make better informed decisions. Thank you, and see you in my next one.